workforce to data and digital tools. This will improve the system's capacity to respond to patients' needs for mental health and substance use support. Because as we know and we say often in this place, mental health is health. Tragically, the toxic drug supply and overdose crisis continues to cause immeasurable pain, suffering, and heartbreak across our country. I want to acknowledge the important work this committee has been doing to study this critical issue. I know that we all share the same determination to end the overdose crisis and to save lives. This echoes what I'm hearing from my counterparts across the country, that we have the same objective, helping Canadians. To do that, we need to learn from experts, in particular those working on the front lines of this crisis. They are truly the heroes of the healthcare system. We need to listen to those with lived and living experience, including family members. And as leaders, we need to work cooperatively to ensure a comprehensive and compassionate approach that is patient-centered. Our government's actions are guided by Canada's model, our goal to ensure that all Canadians have access to services and supports across the spectrum of prevention, harm reduction, treatment, and recovery, while also leveraging enforcement tools to keep our communities safe. As part of our approach, we are investing in programs like the Substance Use and Addictions Program, which allows us to support community organizations who are working directly to reduce harms and support people in need. As you've heard or may know, the illegal drug supply is deadlier than ever before, with potent substances like xylazine and nitazines entering the already lethal illegal drug supply. This reality puts all those who consume substances at high risk. It also compels us to act to ensure that life-saving interventions are widely as available as possible, including in rural and remote areas of the country. Colleagues, we have much more work to do in this space. However, I look forward to having meaningful discussions today on the work that is already in play and how we can better serve Canadians. I look forward to your questions.
Thank you, Minister. We will begin with rounds of questions, starting with Mr. Doherty, please, for 6 minutes.
Minister, thanks for being here today. I have a lot of questions, but first, I know you probably saw Minister Duclos and Minister Anand's press conference on fraud yesterday. Has Mark talked to you about fraud at Health Canada?
I am aware that they are looking into those allegations.
So you're aware of some investigations mentioned yesterday pertain to Health Canada?
I know that there are investigations that are ongoing.
Okay. So are any of the new 5 to 10 cases being examined from your department?
At this point in time, I am not aware that they are.
Okay. So, okay. Thank you. There are investigations underway that involve PHAC.
PHAC also crosses not just my department, but Minister Holman's.
Okay. Thank you.
You're welcome.
Okay. Thank you. Minister, is diversion illegal?
Yes, it is.
Okay, thank you. Minister, is London Intercommunity Health Centre receiving funding through SUAP this fiscal year?
Yes, it is.
Okay, thank you. Minister, have you read the new letter from 72 BC-based addictions doctors blasting so-called safe supply?
I have read the letter, and I've met with many of the experts
Okay.
and physicians with regards to safe supply.
Thank you. Mr. When Dr. Sarita was here the last time, she mentioned that she admitted knowing that some of her prescriptions get diverted. Question, why is her clinic still receiving funds, taxpayer funds?
Thank you for the question, and as I've said in this committee before, I take diversion very seriously, as do all of our department, and at that time we asked officials to thoroughly review the protocols of all of our 21
Okay,
safer
so has
supply
the funding been
projects.
cut off? Your testimony just prior to that was that she is still receiving funds. Her clinic is still receiving funds. Taxpayer funds that are going to, what you said, to a clinic that is prescribing safe supply, that they know, the prescribers know, some of it is being diverted.
So overall, across Canada, diversion is not something new. We know that there are low levels of diversion.
Do you
that
have the
happen.
evidence?
The
you have evidence
RCMP has
regarding-
provided thorough information on their position on diversion. Are you referring specifically to a nationwide lens or specifically to
Is
that
there a
one project?
nationwide lens? Like, is there evidence nationwide with respect to safe supply
The
and diversion?
RCMP has said that there is no evidence of widespread diversion of drugs from prescribed
Oh,
alternatives.
that's interesting. That's interesting because just last week, you're probably aware of it as well, too. There was a large bust in my home community of Prince George where the local officers and local leaders, RCMP leaders on the ground there that said there is widespread evidence and that it is taking place in our small rural communities. Are you aware of that?
I'm aware of that, and I'm also aware that Assistant Commissioner John Brewer at the top Mountie in BC said that notable quantities of prescription drugs were seized, but there's currently no evidence to support widespread diversion of safe supply drugs in the
So-
illicit market in BC or in Canada.
So are the frontline officers that are actually on the ground making these arrests, are you saying that they're lying?
I'm saying that the data is showing us from drug analysis seizures over the past 10 years, including when the Conservative government was in power, that there's been no increase in diversion of hydromorphone over the last 10 years based on the samples.
So there was no...
So from your
how-
previous government's
So how long has the
administration until
SUAP
now,
program
there's been
been in
no
place?
change.
How long has the SUAP program been in place?
Pardon me?
How long
The
is
SUAP
this?
program is ongoing, and the next round of funding will be for the next 2 years.
Okay. Minister, how much, so prescribed safe supply has been, in, your government launched a program, spent about $700 million on that, almost $1 billion. What work did PHAC do prior to, or your department do prior to launching that to study the evidence that safe supply was indeed safe?
So I've just returned from Vienna, where I was at the UN Drug Commission meeting with counterparts such as Switzerland, Portugal, and many other countries who have long-standing evidence of the importance and value of
But I didn't ask
prescribed
that. I
alternatives.
asked what work
So
was
there's
done
ample
prior to.
I'm answering your question. You've
But you,
asked
no,
what
you're saying that
evidence.
you attended. What work was done prior to, by your department, prior to launching that? That was my question.
We are relying on evidence of other jurisdictions to begin our evaluation
Is it-
of what would work
Is
here.
it scientific evidence or is it
Absolutely.
anecdotal evidence?
No, it is not anecdotal evidence. Switzerland has a long-standing prescriber.
Because it's
prescriber
interesting. So
model.
are the 72 doctors and indeed the other 42 leading addictions specialists, are they lying when they say there's no scientific data beyond 7 weeks at the 1 week mortality rate with safe supply?
I reject the premise that anyone is lying. As I said in my opening remarks, we value the opinions of experts, those with living experience, and clinicians, and we include all of them in our contemplations and deliberations.
One question, Minister. Can you table with this committee the work that was done prior to the evaluation, the long-term evaluation that the department did prior to launching the prescribed safe supply, taxpayer-funded safe supply?
I'll pass it to ADM Costins, who was a key policy participant in the program.
Thanks for the question, Mr. Chair. There was an expert advisory group that tabled a report prior to launching the projects. Happy to provide that to the committee.
That would be great. Thank you.
Thank you, Mr. Doherty. Next, Mr. Nakvi, please, for 6 minutes.
Thank you very much, Chair. Welcome, Minister. Thank you for your presentation. You spoke in your presentation about that Canada is going through an opioid crisis. It's taking countless lives, and you see your job, your mission to save lives and help Canadians. And I think every one of us and every Canadian will agree with you that that's precisely what we need to do. My question to you is, what steps do we need to do to prevent these deaths? That's, in your view, the experts you've met, both nationally and internationally, in dealing with the crisis, what are the steps necessary so that we can save the lives of Canadians?
I thank you for the question, and it's what I refer to as the Canada model, which are rooted in 4 key principles that provide a full continuum of care for those who use substances and need supports through our health system. I would say first and foremost, we have to understand that this is a health crisis. It must have a patient-centered lens and also a human rights lens. And when we take that as our starting point in saving lives, we need to understand that the upstream actions that we take are prevention, For those who use substances, we want to create forums for harm reduction, whether it is safe consumption sites, offering outreach centers, and so on and so forth, so that we bring those who use substances into a place of safety and also to be able to open the door towards the healthcare system for them. From there, that we can contemplate treatment. Those who come through our harm reduction services that are provided by provincial jurisdictions are then able to have access to treatment options that are available to them. But all of this works under the understanding that both community safety and community engagement is also important, which is where law enforcement plays an important role in ensuring that drug traffickers, organized crime, money laundering, and those who are manufacturing the deadly illegal toxic supply that we are seeing on our streets is tackled firsthand by frontline enforcement.
Thank you. You mentioned in your answer the importance of safe consumption sites. There's a lot of misinformation about safe consumption sites. There's one in my community here in Ottawa Centre, and I've seen firsthand the manner in which it saves lives and saving lives. They get swap funding, and I'm appreciative of that. Can you explain why these interventions provide critical supports to people who use drugs? Give Canadians a bit of a glimpse in a safe consumption site, and what would they see? You and I have visited one in our respective communities. Many Canadians have not.
Thank you for the question. I'll start by saying that harm reduction is healthcare. It is a healthcare service, and that we know that supervised consumption sites play a key role in that, and we have the data to back it up. Since 2017, safe consumption sites in Canada have seen over 4.4 million visits. They've reversed 52,000 overdoses, and close to 400,000 have been referred to treatment through those processes. So we know that when safe consumption sites are available, that we are reducing the risk of death, disease, and infections by those who use drugs, and ensuring that they have access to a wide range of health and social services to help them on the pathway of treatment and recovery. Closed supervised consumption sites in areas, jurisdictions that do shut them down, we have seen an increase in overdose deaths, but that is also attributed to the very toxic, poisoned street supply. But that means that safe consumption sites also need to be well-resourced, well-staffed, and well-engaged with local communities. When we look at programs such as in Switzerland, Portugal, and other jurisdictions, good resources and well-staffed harm reduction initiatives do yield good results and save lives.
Thank you. 2 minutes. Great. Thank you. You spoke about what we refer to as wraparound services that these safe consumption sites provide. The one in my community in Ottawa Centre at Somerset West Community Health Centre is located as part of a community health center, so they have that capacity. And every time I've had conversations with them, they talk about social detriments to health. They talk about adverse childhood experiences, trauma, poverty, mental illness, and chronic pains, all factors that kind of led to an individual taking these substances and all the effects that goes with it. So can you talk about that type of a patient and the kind of comprehensive approach required to give them healthcare services that is fulsome, dealing with all those challenges that they may be facing?
Thank you for the question, and I think it's important for us to look at the Canada Drug Substance Strategy as an integrated approach. With the renewal of the strategy, which we call the Canada model, we are working across departments now, so addressing poverty, housing, and other social determinants of health. But what we do know is that when someone uses substances, it's a result of we say from the trauma-informed lens, not what's wrong with you, but what happened to you. And that really is a key component of providing the services that an individual needs. We know that in Indigenous communities, there is intergenerational trauma, and we see that reflected in the high proportion of substance users who are from Indigenous communities. We also know that there are a myriad of factors that can result in someone using substances, whether it's through prescription opioids from pain management or other factors. And our job once they come to us for help or to their local health